اتاحت الفرصه لي ان انا اكون موجود وسط الكوكبه اللامعه من اساتذتي وزملائي الاعزاء. بشكر الساده الشير بيرسونز. بشكر شركه الاسراء اللي احنا هنكون كلنا في ضيافتها لمده 15 دقيقه الجايين. هتكلم معاكم عن الفونوبرازان افريند اور فو. الفونوبرازان هو ظهر من فترة قريبة جدا، في ناس ستيل اندر ترايل. طبعا احنا هنا في مصر المايند سيت اتعود على البي بي اي بقاله فترة طويلة، بس اظن جه الوقت ان احنا نجرب نيو ايرا اوف دراجز لميني جاستروانتستينال ديس اوردرز. طبعا احنا بنتكلم بما اننا في ضيافة شركة اسراء، فاحنا بنتكلم عن برودكت من اهم البرودكتس بتاعتهم، هو البرودكت الفوناسيدان. طبعا هتكلم عن الميكانيزم اوف اكشن اوف بي كاب طبعا في عجاله، يعني انا هكمل مكان ما استاذي الدكتور محمد مجدي انتهى. Vonoprazan stably accumulates in the acidic secretory canaliculi and non-covalently binds to hydrogen potassium ATPase with a very slow dissociation rate. Therefore can inhibit newly exposed hydrogen potassium ATPase enzyme for a long time. البي كاب بالرغم انها completely different بس برضو يعني بتتفق مع البي بي اي انها inhibits البروتون بامب and suppress gastric acid secretion. ليها direct action على الهيدروجين بوتاسيوم ATPase as previously mentioned, so therefore doesn't require conversion into pharmacologically active compounds. شكرا. طبعا هي reversibly inhibiting البروتون بامب which is responsible for final stage of gastric acid secretion. طبعا في منها ريفابرازان، فونوبرازان، تيكوبرازان اند فيكسوبرازان. طيب السمري كده سريعا للفونوبرازان بروبرتس انها طبعا نوت افكتد باي فود، ملهاش علاقه طبعا بالميلز، يعني ممكن تتاخد قبل الميل او تتاخد بعد الميل على طول مباشره. binding to resting and stimulated gastric glands, reversibly inhibit hydrogen potassium ATPase independent of acidic pH. Stable in the presence of acid and is water soluble and doesn't require a specific pharmacological preparation. Demonstrates maximum acid inhibitory effects from the first day of administration. Selective, reversible and dose-dependent inhibition of hydrogen potassium ATPase. طب هنا ايه اللي خلى البي كاب تظهر؟ هو ان كان في unmet needs of PPI. البي بي اي طبعا زي ما احنا عارفين البروتون بامب انهبيتورز انها covalently binding prodrug, acid needed for activation but unstable in the presence of acid, meal required to stimulate pump, short plasma half-life of 1 to 2 hours, and primary metabolized via cytochrome B2C19. Therefore, it gives a slow onset of action, limited potency and limited duration of activity. Whereas the vonoprazan as competitive enzyme inhibitor, stable in acid, bind with slow dissociation rate, long plasma half-life of 7 hours, and primarily metabolized via cytochrome B3A45. Therefore, rapid onset of action, potent acid control, and durable for 24-hour activity. Here we shall discuss rapid comparison between BPI and vonoprazan. There is a study of acid inhibitory effects of vonoprazan 20 mg compared with esomeprazole or rabeprazole in healthy adult male subject, study in 2015 in Japan. Here, as we see that there is stability of intragastric pH in the B-cap other than the BBI. Another randomized trial of acid inhibition by vonoprazan 10 and 20 mg once daily versus rabeprazole in healthy Japanese volunteers, a study called Samurai pH study in 2015. Conclusion, vonoprazan 20 mg once daily exerts a more potent and durable acid inhibitory effect as compared with rabeprazole 10 or 20 mg twice daily. Therefore, this pharmacodynamic profile of vonoprazan makes it useful as an initial treatment of GERD, reflux esophagitis, for achieving of early mucosal healing. Another randomized clinical trial for safety, tolerability, and pharmacokinetics and pharmacodynamics of repeated doses of vonoprazan as a novel potassium competitive acid blocker in healthy male subject, also 2015 in Japan. Conclusion, vonoprazan might have advantages over existing acid suppressing drugs such as maximum efficacy after the first dose, therefore preventing nocturnal acid breakthrough, reducing nighttime gastric acidity, and the ability to dose at any time regardless of meals. In conclusion, in these two phase 1 studies in healthy male subjects, vonoprazan at multiple rising dose levels of 10 to 40 milligram once daily for 7 days produced rapid, profound, and sustained suppression of gastric acid secretion and was well tolerated. The intragastric pH on day 7 showed good pH control throughout the 24-hour dosing interval. pH more than 4 with HTR more than 83%. Another study comparing pharmacodynamics and pharmacokinetics of the potassium competitive acid blocker vonoprazan versus lansoprazole in US subjects. Holding time ratio and mean intragastric pH 24 hours for vonoprazan and lansoprazole was favoring for vonoprazan. Therefore, the comparing between BBI and vonoprazan, we shall see here that no activation required and stable in acidic conditions, reversibly blocks active proton pump and remains associated with the active and inactive proton pump, plasma half-life of 7 hours, achieves target 24-hour acid suppression within 2 hours of single dose, dosing independent of meals. Therefore, here we shall discuss about some efficacy studies, randomized clinical trial, a dose-ranging study of vonoprazan, a novel potassium competitive acid blocker versus lansoprazole for treatment of erosive esophagitis. Notably, the proportion of subject heals with vonoprazan 10 mg at week 2 suggests that the rapid onset of vonoprazan effects may need translate into a shorter healing time in patients with erosive esophagitis, particularly in those with more severe Los Angeles grading C and D. Once daily vonoprazan was effective at all doses studies and non-inferior to once daily lansoprazole 30 mg for healing erosive esophagitis. In addition, vonoprazan 20 mg or higher was efficacious for erosive esophagitis healing at weeks 2 and 4 for subjects with severe erosive esophagitis at baseline. There was no safety concern associated with vonoprazan during this 8-week study. Another study about the efficacy of vonoprazan for initial and maintenance therapy in reflux esophagitis, NERD and proton pump inhibitor resistant GERD. Vonoprazan therapy was effective for initial and maintenance therapy in 3 groups: reflux esophagitis, NERD, and BBI resistant GERD. Especially vonoprazan therapy improved heartburn and patient satisfaction significantly even in the BBI resistant GERD group. Among patients whose symptoms disappeared and stopped taking vonoprazan during the maintenance period, 42% of reflux esophagitis and NERD group and 30% of PBI resistant group had no relapse of symptom after stopping of medication of vonoprazan at 24 weeks. The complete remission of GERD can be achieved by introduction of vonoprazan. Another trial, Falcon for erosive esophagitis, phase 3 trial. Vonoprazan therapy was effective for initial and maintenance therapy in 3 groups: reflux esophagitis, NERD, and BBI resistant GERD. Especially vonoprazan therapy improved heartburn and patient satisfaction significantly even in the BBI resistant GERD. Safety data for summary of Falcon erosive esophagitis. Overall, the safety results for vonoprazan observed in the Falcon erosive esophagitis study were consistent with those observed in the prior clinical studies. Vonoprazan-based regimen is more useful than BBI-1 as a first-line Helicobacter pylori eradication. A randomized controlled trial was done in 2017 and published in the Canadian Journal of Gastroenterology and Hepatology. Conclusion, it concluded that Vonoprazan-based regimen is safe and more efficient than PPI-based regimen as a first-line H. pylori eradication therapy. Vonoprazan may be a key agent to improve H. pylori eradication rate and prevent gastric cancer consequently. Another study about vonoprazan and preventing ulcer recurrence during long-term non-steroidal anti-inflammatory drug therapy, randomized lansoprazole controlled non-inferiority and single-blind extension study was published in 2018. This study concluded that vonoprazan 10 and 20 mg were effective and well tolerated for prevention of peptic ulcer recurrence during non-steroidal anti-inflammatory drug therapy in at-risk Japanese patients, and the preventive effect was maintained with long-term use. The safety profile of vonoprazan 10 and 20 mg during long-term use was similar to that of lansoprazole 15 mg, and no new safety issues were identified. The lower dose of 10 mg has been approved in Japanese as the clinical daily dose of vonoprazan for prevention of recurrent peptic ulcer during long-term non-steroidal anti-inflammatory drug therapy. Another study about vonoprazan preventing low-dose aspirin-associated ulcer recurrence, randomized phase 3 study, was published in 2018. GI bleeding rates were higher with lansoprazole compared with low doses of vonoprazan in both 24-week study and extension study. Therefore, we conclude that vonoprazan was well tolerated and its preventive effect on ulcer recurrence endured with long-term use. In addition, vonoprazan 10 and 20 mg showed a significantly greater preventive effect compared with lansoprazole 15 mg on the development of bleeding in the stomach or duodenum. Therefore, vonoprazan appears to be a useful alternative to lansoprazole for secondary prevention of low-dose aspirin-associated peptic ulcer at the recommended clinical daily dose of 10 mg. Therefore, no therapeutic advantage in 20 mg over 10 mg was shown. Finally, take-home messages. The pharmacodynamic profile of vonoprazan makes it useful as an initial treatment of GERD, reflux esophagitis, for achieving early mucosal healing. Vonoprazan might have advantages over existing acid-suppressing drugs, such as maximum efficacy after the first dose, prevention of nocturnal acid breakthrough, reduction in nighttime gastric acidity, and the ability to dose at any time, regardless of meals. Vonoprazan is effective at all doses for healing erosive esophagitis. Vonoprazan-based regimen is safe and more efficient than PPI-based regimen as a first-line H. pylori eradication therapy. Therefore, vonoprazan may be a key agent to improve H. pylori eradication rate and prevent gastric cancer. Vonoprazan 10 and 20 mg were effective and well tolerated for prevention of peptic ulcer recurrence during non-steroidal anti-inflammatory drug therapy, and the preventive effect was maintained with long-term use. Vonoprazan appears to be a useful alternative to PPIs for secondary prevention of low-dose aspirin-associated peptic ulcers. Thank you.
شكرا دكتور أيمن for this topic on vonoprazan.